Welcome to the USMLE Step 2 Clinical Skills Examination. This is your test center orientation. Each encounter begins with the examinee instruction sheet. It includes information about the patient in that room: name, age, gender, and the reason for coming to see the doctor today.
Examinees, you may begin your first patient encounter.
The clock starts when the announcement tells you to begin the encounter. You may then open the instruction sheet panel. The instruction sheet includes vital signs, which you should accept as accurate, and which you may repeat if you feel the case warrants that confirmation. However, if you do repeat the vital signs, continue to consider the vital signs as originally listed when developing your differential diagnosis and workup plan. If this is a telephone case, you'll find additional instructions for using the phone inside the room once you enter. Once you're through reading the instruction sheet, simply knock on the door and enter to see the standardized patient. You may introduce yourself however you wish. For most of the 12 cases that you will see, the standardized patient will be in a gown on the examination table. In some cases, however, the standardized patient may be sitting in a chair. The standardized patient will remain in role throughout the entire encounter. Please do not attempt to communicate with the standardized patient outside of their patient role. There are a few pieces of equipment to demonstrate. First, each room has a small stool or chair for the clinicians to sit on if they wish, and on that stool or chair, you'll find the sheet or drape for the standardized patient. There is only one blood pressure cuff size in the room. It will fit all of our standardized patients. The ophthalmoscope and otoscope. The otoscope light should come on when you lift it off the wall. However, if it does not, there are a couple of things to check first. The dimmer switch is in the handle. It is possible that the examinee before you may have inadvertently left the dimmer switch down, so do check that first. Then it is possible that they may have turned the power switch off. Please use care when examining the ears with the otoscope. The otic speculums are disposable. Throw them out when you are done. The ophthalmoscope should also come on when you lift it off the wall. Again, the dimmer switch is in the handle. If you have any problem with the equipment in the room, open the door and wave to the proctor. The proctor will be happy to assist you. Please don't leave the room. If you wish to dim the lights in the room, there is a switch nearby. If you hit that switch, the large overhead light will go out and a small dim light comes on so that the room is dim but not completely dark. On a small glass shelf next to the exam table, you'll find a couple of tuning forks and a reflex hammer. There is a jar with tongue depressors, and then another jar with cotton balls and cotton-tipped applicators. There is also a small jar with toothpicks for pinprick sensation. These are all disposable. Throw them out when you're done. Next to the sink, there's a small jar with alcohol wipes, and then the sink with soap, water, and paper towels, and a cup dispenser. The water is drinkable. There's also a box of medium and a box of large gloves. Please wash your hands with soap and water before each examination or wear gloves. If you currently have any skin rash or open cuts on your hands, please wear gloves. And then there is an eye chart that says, "Eye test chart for 10 feet," and the rooms are about 10 feet in length. There are a few features of the exam table to point out. First, at the foot of the bed, there is an extension for the patient's feet in case you need that. There is another component to the exam table, and that is, at the foot of the bed, is an extension with a small step stool in case you need that for the standardized patient to step on or off the table. To raise the head of the bed, you simply lift the head of the bed. To lower it, there's a small silver metal lever on the side of the exam table. Push that lever, but be sure to hold on to the head of the bed so it doesn't come down too quickly. Your time with each patient is limited, so concentrate your history questions on the patient's chief complaint using the general history as necessary. Perform the physical exam maneuvers exactly as you would for a real patient, respecting their comfort and modesty as you do so. Be prepared to find positive physical findings and accept any simulated physical finding as real. Keep in mind that standardized patients are subjected to repeated abdominal exams and that meaningful information can be obtained without unnecessarily forceful or deep palpation. Please do not perform rectal examination, internal pelvic exam, genital or genitourinary examinations, including inguinal hernia exam, female breast examinations, by which we mean palpation of breast tissue or nipple, or corneal reflex examination. Please don't perform the restricted physical exam maneuvers. They may be ordered as part of the diagnostic workup if you feel they are indicated. All other examinations are completely acceptable, including femoral pulse exam, inguinal node exam, back exam, and axillary exam. The female patients will be wearing bras, which you may ask them to loosen or move if necessary for proper examination. Postural vital signs may be done if you feel the case warrants it, but you should not use your findings when developing your differential diagnosis or workup plan. Continue to use the vital sign information on the examinee instruction sheet. After 10 minutes, you'll hear an announcement letting you know that 5 minutes remain in the encounter.
There are 5 minutes remaining in this patient encounter.
Once you're through with the history and physical exam, conclude the encounter professionally and cordially. Be sure that you have all the information that you need before leaving the room, because once you've left, you won't be able to go back in.
This patient encounter is now over. You must now leave the room.
Once you're through seeing the standardized patient, you'll then complete what we call the patient note. This is the medical record of the encounter for recording the information you obtained during the encounter. You'll have 10 minutes to complete the note. If you leave the room early, you may start the note early, and that time would be additive. If you've left something behind in the exam room, just let the proctors know. They'll be happy to go back and get it for you. You may not go back into the room yourself. The form will be waiting for you outside the exam room on the desk. You may either write or type the patient note, but once you select the format for a given encounter, you must continue that format throughout the encounter. If you choose to write your patient note by hand, do not touch the keyboard at that station, because doing so will generate a blank patient note. If you accidentally touch the keyboard, notify a proctor immediately. The formats for both the written and typed note are quite similar. The amount of space and the scoring is comparable for both. If you choose to write, please use only the front of the page. Notice the perimeter of the form. There's a black margin there. Marks outside of that black line will not be picked up by our scanners or photocopiers, so please keep all of your writing inside of the black box. If you're typing, we're using a standard word processing format, and the space that you see is slightly larger than what is on the screen, so there is a scroll bar on the side of the box. Please note the progress bar at the bottom of each field. It will let you know how much space is remaining while you are typing. You may list the vital signs if they are particularly relevant to the case, but in general, the patient note is for the pertinent positive and negative history and physical exam findings relevant to the patient's chief complaint. Try to be as specific as possible when you are writing up the elements of the physical exam, and try to avoid simply writing the term normal. For example, if you find equal sensation bilaterally on a neurologic exam, write that instead of neuroexam normal. List up to 5 diagnoses in the approximate order of likelihood, and remember, these are common cases. The diagnostic workup should represent the first-line tests you would like to use to narrow down your differential diagnosis. Examples include blood tests, X-rays, CT, EKG, urine analysis, diagnostic procedures. Try to be as specific as possible when ordering diagnostic tests. CBC, electrolytes, and urine analysis are fine, but not the more general terms such as chemistry or SMAC or LFTs. The workup should not include therapy or management, so it should not include drug treatment, therapeutic procedures, or operations, nor should it include consultations, referrals, or dispositions such as admit patient to hospital. The Orientation CD and the USMLE website have a list of acceptable abbreviations, and the list will be available during the exam. These are the abbreviations that we are guaranteed to understand. The notes are read by practicing clinicians, so use your judgment. When in doubt, write out the word. When the announcement comes to stop writing, please do stop writing or click Submit on the computer form. The proctors will then collect the patient notes and the blue scrap paper for that encounter. The blue scrap paper is shredded and not used for any type of scoring. Then, stay seated until the proctor tells you to move to the next station, and wait until the announcement tells you to start the next encounter. Someone will be available in a moment to answer any remaining questions. Feel free to try out the equipment in the orientation room. Remember, when in doubt, just do what you would do in a real patient encounter.